Hi, my name is Dylan Leroy. I'm a registered clinical counselor at Simon Fraser University, Health and Counseling Services. I've been working here for the past 15 years at Simon Fraser. I began my career as a career advisor, then I returned to school to study my master's in clinical psychology. After completing that, I did a practicum actually here at Simon Fraser, and then I continued on as a staff member. I've also worked in the community with the RCMP in the City of Surrey in the Youth Intervention Program. I have a great passion for trying to assist students because I remember my time at university being challenging and also rewarding. So that's what I try and bring to the students here is my experience and care. Here at our center, we do track what brings people in. Now we don't diagnose, but the two big ones are depression and anxiety. If we think of many of the students at university, they're in the sort of 20 to 30-year-old age range. For some, that's when the symptoms associated with anxiety and depression become a bit more prevalent, so then we can start to treat that. In addition, university is exciting time, but also a time of distress. So as expectations around performance, perhaps transition away from historical supports such as family and friends in high school, transition to a new city if you're an international student or coming from out of province. All those changes can increase stress, and without all those protective factors in place, that can move someone towards a lower mood and also increase things such as anxiety. I would really encourage people to reflect on their just overall well-being. So if we define that as looking at how our mental wellness is doing and also how our physical health is doing. So if you start to notice a shift in your level of activity, so if you usually liked going out for a jog, but now you find you're not doing it anymore, or if you notice that you're withdrawing from friends and families and you used to be a very social person. So any shift can be an indication that there's something going on that may be problematic with your mental health and your well-being. If you start noticing more severe symptoms like a lack of energy, trouble leaving the home, then that's definitely a really good time to try and connect with a mental health professional, whether it be a counselor or a doctor or a psychologist. The thing I really encourage students when I do meet with them, and Simon Fraser University as a whole encourages students to get really engaged and involved when they join the community. That can be really overwhelming if you're a new student and perhaps feeling out of place. A good first step is to try and join something like a club, try and take advantage. At SFU we're very fortunate we have a wonderful recreational facility, so you can build connections there, intramurals. If those things don't fit for you, looking within your faculty, even if you haven't defined it yet, trying to get involved with the student unions can be really good. Biggest tip I could give is maybe turn to your left or turn to your right, stop looking at your phone and say hi to the person sitting next to you in class, even though that can be very intimidating, because people end up walking around feeling as if they're the only ones feeling alone, where there's thousands and thousands of people feeling alone at the same time. Another thing I'd encourage you to do, regardless of what university you attend, is most universities, actually all that I know of in the Lower Mainland, have counseling supports available. Some also have medical supports available. So see what resources you have access to and leverage them. Many of them are part of your student fees, so I encourage students to leverage that. Check in with a counselor or a doctor. If you can be preventative, that's helpful. So the more you can build resiliency around your wellness, the less likely you'll experience symptoms of depression and anxiety. Many people wait until they're feeling really horrible to connect for support. So I encourage people to start right away. Even if you're feeling great, go see what resources. For example, here we're very lucky. We have some free mindfulness drop-ins. We have some yoga therapy that we're offering. We do the puppy therapy. So all those things can add up into increasing your wellness. Well, that's individually defined, I suppose, for everyone, with some broad tips around self-care. I remember when I first started being a counselor, I never understood why we always had to ask everyone, how's your eating, how's your sleeping, how's your exercise? So if we think of those base level things, if we have a roof over our head and we have the opportunity to get access to good food and exercise, very important for well-being. They're the base level. If those are met and you're still finding some challenges, then it's about trying to engage with others if that brings you a sense of joy. We're kind of community-based people, and trying to keep yourself in a routine that feels healthy, which can be really challenging in school because we're up all night studying. At the same time, when those really crunch periods pass, try and set that routine in place so that you can stay well. Somewhat biasly, I suppose, I think we're pretty fortunate at Simon Fraser University. We have an amazing team down here at Health and Counseling Services to support students. So we try and approach people holistically. So as far as clinical supports, we have our doctors, mental health nurse, psychiatrist, and as counselors and psychologists. So for our students, they also gain access to some amazing seminars and groups that we run throughout the semester. Some examples of that are we offer a Skills for Successful Self-Management, which is a mindfulness-based group. We also offer some really exciting, called Stress 101, which is body-centric support, so using your body to help reduce stress. We have ACT on Anxiety groups. We have some interpersonal skills groups. So there's lots of groups to check out. And most universities provide us similar types of supports, where they'll have group-based supports and then individual-based supports. And we have special events. Everybody loves puppy therapy, so the puppies come and everyone gets to pet them. And cats. We had cats, which was pretty exciting. I can't speak to all campuses. I can speak to our campus at Simon Fraser University. I'd say a lot of very strong efforts have been taken to reduce stigma. So we have a group called High Five, which was started by our Associate Director, Dr. Erica Horwitz, in conjunction with the student body. So they are now an independently operating unit that connects with us. That their mission and mandate is to reduce stigma on campus in regards to mental health. We also have an amazing health promotion team that's been working on a lot of different areas, but one of them was also around increasing awareness around well-being and mental health being a component of that. So in my time here, I've been a counselor for 9 years. I'd say the stigma has reduced. It's become more normative to seek support. I think some amazing campaigns have been done in the community, such as the Bell Let's Talk campaign, to help bring to light that struggling with your mental health is something that is no different than struggling with a physical illness, so that people don't feel shame that there's something intrinsically flawed with them and that they aren't deserving of seeking support. So I'm happy to say in my time here I see more people accessing, and we are a very diverse population here at SFU, so I'd say too we see more diversity of people accessing our supports, which is very exciting. If people are waiting to connect with a counselor, thanks to technology, there's been great advances in the types of supports you can access on your own. So for example, the Mood Disorder Association British Columbia has some amazing resources. As well, there's an amazing suite of apps that are available. I tend to promote the free ones, so the MindShift app for anxiety is very, very helpful. In addition, if you do look at any university website, even if you're not a community member of that university, that's a good place to find lists of refutable resources. So Google or search a university and then see what their top lists are. So for example, on our website, we have some free links to progressive muscle relaxation, mindfulness, body scans, some yoga, some stretching. So I know when I'm looking for resources, that's usually where I start, is with the universities. Distress services lines are really helpful. I think it's again around that maybe a bit of a misconception that you only call a distress service line if you're suicidal, where a distress service line can be really helpful if you're feeling stressed and you need to talk to someone. Mm-hmm. One of the most challenging aspects of suffering is if we're suffering in isolation. And then if we have that opportunity to connect with another caring person, then our distress tends to dissipate a little. So I really am a big fan of distress services. For anyone who's a student in a post-secondary institution, if you're noticing that you're distressed, connect with support. Even though you may feel as though someone may not understand, or that talking about it isn't going to fix the challenge, if you can connect with the supports on your campus, chances are they'll be able to point you in the right direction and offer some care. So regardless whether it's a counseling center, a health center, the ombudsperson, your academic advisor, reach out to the community. In my opinion, many, if not all of the people who work in university are there to support students, especially within student services. So take that risk and muster the courage to reach out if you're confused, or if you're suffering, or if you're uncertain.